Chevy Chase.
Welcome back. It's now time for Talk of the Town, and today it's about some of the biggest health concerns people face during the summer months. While summer is made for vacations and outdoor fun, it's also prime time for allergies, bug bites, and something weird called alpha-gal syndrome. Maybe you've heard of it. Here to break it all down for us and give us tips on how to stay healthy this summer, we have Dr. Alexandra Patterson with the Lexington Clinic. Welcome to the show.
Thank you so much. Good to meet you both.
Yes. So I suffer from allergies year-round. It is Kentucky.
Absolutely.
But what is peaking right now?
So right now we're about to get into the weed season. So ragweed, all the other weeds, the ugly stuff that people are allergic to. Yeah, we're starting to get out of the grass season, which is summer.
Right. I know that's something you suffer from.
I'm
so,
allergic to everything.
you know, this time of year when people get sick, they don't know if it's allergies or if it's a cold or the flu. How can you tell the difference?
It's sometimes really hard to tell. For a lot of people, they can look the same. But infectious diseases like the flu or a cold, you'll have fevers often, chills, body aches, but it should get better pretty quick, within a week or two. Where allergies, they keep coming back. They just linger and last. It can be really, really debilitating for a lot of people.
Yes.
It can be, and luckily there's help. So when should somebody seek out the help from an allergist?
Yeah, so there's allergy medicines are probably the most over-the-counter medicines people think of. So people are trying all kinds of stuff. But if those aren't working, if you're getting infections, if it's impacting your job, you can't go to work. I mean, once we can, really nail down what people are allergic to, we can come up with a good customized treatment plan. And there's all kinds of things that we can do beyond just the over-the-counter medications.
Well, I'm trying to get Tamara over her allergy for cats because I love cats. So.
Absolutely. We've got lots we can do. I always tell people I know they're going to get rid of me before they get rid of their pets. So I'll try and keep the pets in the home if I can.
Yeah, I did do allergy shots for a while, and they were very helpful. Very, very helpful.
Yeah.
So that's good to know.
Absolutely.
And then talk to us about the ticks and the alpha-gal syndrome. What is this?
So alpha-gal syndrome, it's a really interesting disorder. It's a food allergy where people get tick bites, and then in the months after that, a Lone Star tick bite particularly, they then start to develop allergic reactions to mammalian meat.
It's so interesting.
So beef, hamburgers, steaks.
Yeah, beef, pork, and lamb are the most common ones, but anything, if people who eat guinea pigs or squirrels or deer, all of that stuff, and they're delayed. It happens like 3 to 6 hours later. So people wake up in the middle of the night with an allergic reaction, don't think about what could have caused it.
Yeah.
It's really scary.
Yeah.
So if someone gets bitten by a tick, should they be concerned? What should they do? What should they look for?
So we have to look for symptoms of the disorder. Just because you have a tick bite doesn't mean you're going to get this. Obviously, tick bites are not good, so you want to avoid those. But it's all about the symptoms of the disorder. So hives, itching, swelling, rashes, wheezing, vomiting, diarrhea, all this stuff after mammalian meat products. And it's it's going to be delayed. It's not quick. So if you start to notice I'm having allergic reactions, what's going on? Just see an allergist. Let us sort it out for you.
Yeah. And then how is that diagnosed?
So the biggest thing is the patient's story. I have patients who come to me all the time because somebody, a primary care doctor or whatever, has ordered a blood test after a tick bite. But that doesn't make the diagnosis at all. You have to be having the symptoms. There was a recent CDC study that showed that like 24% of Kentuckians, when they do blood donor research, have the positive antibody. But you have to have the symptoms of the disorder. Only much fewer people actually have the disorder than have the blood test being positive.
And you called it the longhorn tick?
Lone Star tick.
Lone Star. I thought it was a Texan. I didn't know what it was.
The Lone Star tick.
And there are a lot of them here in Kentucky, right?
Yes. Yeah. I don't know exactly why we're the region for it, but this whole region, we definitely have them, and I'm seeing all kinds of patients with this disorder.
Oh my gosh.
Yeah.
So how do we best protect ourselves from ticks and all these other bugs?
Sure. Well, it's always complicated because the people who come in with this disorder are the hunters and the outdoorsmen, and they always tell me that they're not going to change their life. But, but tick sprays, wearing long pants, doing tick checks after you've been outside, that's really the best way you can reduce your risk, but still live the life that you want to live.
Right. Well, thank you so much for that information.
Of course.
This is great. And luckily you all there at Lexington Clinic are on the standby at all times.
Absolutely,
to help us navigate this Kentucky thing that we have going on with allergies and bugs. All right, well, we're going to have all of the information for the Lexington Clinic Allergy, Asthma, and Immunology Department up on the screen.
All right, stay with us. What do you get when you mix art, adventure, and a credit card? Well, you might get a masterpiece. Up next, we're meeting an artist whose creative process is anything but ordinary.